Good morning and welcome to AMSA's webinar titled Medical Services Program Coverage During COVID-19 for BC's Temporary Residents. My name is Sabrina Dimitra and I'm AMSA's Settlement and Integration Program Manager, and I will be leading us through today's webinar. Before we begin with the webinar, we would like to acknowledge that the AMSA office is located on the unceded territories of the Squamish, Tsleil-Waututh, and Musqueam nations. We would like to give them our thanks, gratitude, and respect. On the next slide, we would like to also thank our funder for today's event. We'd like to thank the Government of Canada's Migrant Worker Support Network project for funding this event today. And so we'll have our first speaker in a moment, Kate Puckett, and then we'll be having our Q&A session after that. And so I just wanted to, on the next slide, introduce Kate so that she can take us on and share the content for today's webinar. So thank you so much to our speaker, Kate Puckett, who's a Director of Beneficiary Services and Strategic Priorities Branch at the Health Sector Workforce and Beneficiary Services Division of the BC Ministry of Health. So thank you so much, Kate, and I'll hand it over to you.
Great. Thank you, Sabrina, and thank you for everyone for joining the webinar today. Again, my name's Kate Puckett, and I'm with the BC Ministry of Health in the Beneficiary Services and Strategic Priority Branch. I would like to review the legislation and regulation that guides our work and that we must adhere to in our decisions. Also, I'd like to go over MSP eligibility and coverage effective dates in a non-COVID world, so that would be coverage under normal circumstances. I will then go over COVID-specific MSP policies or temporary policies that may be applicable to those who are temporary residents of BC. I will then go over the enrollment process and provide some references and contact information if any additional information is needed. I know that Sabrina pointed to this previously, but knowing that MSP can be complex and every individual's case is unique, I will be providing a general overview of the MSP program, knowing that at the end of this slide deck, there is references and contact for information for any specific information or any follow-up questions. So to begin with for today, looking at our legislation and regulation, the Medical Services Plan of BC operates under, first of all, the Federal Canada Health Act. And this federal legislation aims to ensure that all eligible residents of Canada have reasonable access to insured health services without direct charges at the point of service. It then looks to the provinces. So we have the Medicare Protection Act in BC that, again, is the provincial legislation and has a purpose to preserve a publicly managed and fiscally sustainable healthcare system in the province. Within the Medicare Protection Act, we also have a definition of a residence for the purpose of MSP enrollment. We'll be covering that on the next slide. But further to the MPA, the Medical and Healthcare Services Regulation includes a definition of those who we deem residents for the purpose of MSP registration or enrollment. And MSP eligibility is outlined partly as a definition of resident in the MPA. So in order to qualify as a resident of British Columbia for the purpose of MSP enrollment, and I know that there are varying definition of residents for other purposes, for instance, for tax purposes. So to be defined as a resident for the purpose of MSP enrollment, an individual must meet 3 requirements. So first, one must be a citizen of Canada or be lawfully admitted to Canada for permanent residence and make their primary residence and have principal residence in British Columbia and be physically present in British Columbia for at least 6 months in a calendar year or a shorter prescribed period. Just a note on that 6 months, for MSP purposes, we define 6 months as 183 days. The Medicare Protection Act also points to those who we may deem to be a resident under the Act, and this includes those who possess a work or study permit for a period of 6 months or longer. Looking at the enrollment effective date, new and returning residents who have completed enrollment must fulfill a wait period before coverage begins. That wait period is the balance of the month in which the individual arrived in BC plus 2 months. It is important to note that if absences from Canada exceeds 30 days in total during this period, eligibility for benefits may be impacted. I did want to include a note here about the eligibility and portability agreement. This ensures that residents of Canada have uninterrupted medical coverage while moving between provinces and within the country. An individual's home province or territory would be required to provide healthcare coverage for the duration of the wait period in the individual's new province or territory. So again, this is applicable for those moving within Canada and looks at or coverage for acute care, hospital services, and or physician services. So knowing that there is a wait period, there is a defined process for waivers of this wait period. And we do have a website that defines all the criteria for application for this waiver. The application is then reviewed by the Coverage Wait Period Review Committee, and they do look at a number of elements for approval. So that is coverage under normal circumstances. There were a number of temporary MSP policies that have been implemented as a result of the COVID-19 pandemic and the state of emergency in our province. Temporary MSP policies in place during the pandemic include a waiver of the coverage wait period and temporary coverage for eligible individuals. So I'd like to go into a little bit more detail for these policies. If you go to the next slide, please. So first, waiver of the coverage wait period. The policy is the MSP coverage wait period will be waived for eligible individuals. This is inclusive of those who complete enrollment in MSP with a valid work or study permit of 6 months or longer. So there is the ability to have date of arrival coverage. Just noting that this is effective no earlier than March 1st, 2020. So just a few specifics on this. When waiving the wait period for individuals enrolling in MSP during the COVID-19 pandemic, coverage will be effective the first day of the month in when the application for enrollment is received between March 1st or as of March 1st. So the waiver or if enrollment is requested for an earlier date based on when residency was established, coverage may be effective as of that date, but the waiver of the wait period may be applied no earlier than March 1st, 2020. So we know that there are some instances where individuals who may have been in BC may be unable to leave the province as a direct result of COVID-19. As such, we've developed policies for those who may be in the province with expired permits. So normally, MSP coverage would not be available for individuals who will remain in the province with expired work or study permits. As such, temporary coverage may be available. An individual may be eligible if they are in BC and were previously enrolled in MSP as a deemed resident. Coverage period would be provided until July 31st, 2020. And there are some time limits that have been applied based on the IRCC dates for issuance of a new permit. So based on that, we did look back to those who may be on implied status, and they would be eligible if their permit expired December 1st, 2019 or later. For those who are on a valid work or study permit and they have not applied for a new permit, this policy would be applied if their permit expired March 1st, 2020 or later. And in applying this coverage, the temporary coverage will be provided on the first day of the month in which the request is received, between the time period of March 1st and July 31st, 2020. When we're looking at coverage for those who may be in the province with a work permit, so those coming to the province, temporary foreign workers coming to the province, I see two different avenues for explaining coverage. First of all, temporary foreign workers in BC with a permit of 6 months or more are deemed residents under the Medical and Healthcare Services Regulation and eligible for MSP enrollment. For these individuals, the wait period is being temporarily waived during the pandemic, so they may have day of arrival coverage. Temporary foreign workers in BC with a permit of less than 6 months would normally not be eligible for MSP coverage. However, during the pandemic, we realized there are some workers that have been deemed essential and will be traveling into the province. We have looked at temporary MSP coverage, which may be provided until July 31st, 2020, or the end of the permit, whichever is sooner. Just looking at the enrollment process, if it's someone who it's a new MSP or registering or looking to enroll for new MSP coverage, one must complete an application for enrollment, and that may be done online or by using a paper form. As part of this application, one must provide valid supporting documentation, which for someone in the province on a work or study permit would be providing a copy or a photocopy of the actual permit. And in this case, a non-photo BC services card will be issued. For temporary coverage, including those who were previously enrolled, one must contact our third-party service provider, Health Insurance BC, and once that temporary coverage is provided, a confirmation of coverage letter with the individual's personal health number and coverage dates will be issued. I provided a list of different references online for general information, eligibility and enrollment, the links for applying for MSP. That also includes the link to the paper form, and the MSP response to COVID-19 page, which has a little bit more or some of the detail I've explained today. I've also included my branch's email. So if anyone has any questions or further questions to what we've discussed, please feel free to email health-bsb@gov.bc.ca. I've also provided health insurance phone number and email address. I would just like to note that I was told yesterday that although the application form is in English, Health Insurance BC, their contact center, does provide assistance or service in other language that includes English, French, Punjabi, Cantonese, and Mandarin. So that's the end of my slides today. I would like to pass it back to Sabrina for any follow-up questions. And thank everyone again for joining today.
Thank you so much, Kate, for your presentation. The questions have been coming in, and on the next slide, you will be able to see how you can submit your questions to AMSA during this time. Could you speak a little bit more about temporary coverage for eligible individuals if they were previously uninsured? They right now would be eligible, but they previously were not eligible.
So they would be eligible because they have a valid work or study permit?
Yes, they would be eligible due to the current COVID situation, the current.
Okay. So we are, just to be very clear, we are not enrolling individuals who are ineligible. However, there is physician services that are available to those who are ineligible. So they are not enrolled in MSP. However, there are services that will be available specific to COVID-19. Does that answer the question? I think that's where the question is a little bit confusing, is that temporary coverage and full enrollment is not being offered to those who are ineligible. However, we are ensuring that the physician services that one may require for diagnostics or treatment are covered.
Okay, and I would welcome the individual who submitted that question if there's any follow-up to maybe clarify and resubmit that question for Kate.
Yeah, or you know what? Email me at that email address, and we can have further conversation.
Perfect. Another question is in regard to considering the recent waiver to the 3 months wait time.
Hmm.
Um, in the case of seasonal agricultural workers, can
Hmm.
they still apply even though they may not be in BC for that 6 months period?
Yeah, so
So
I'll go back to the question or the information I was outlining earlier for the temporary foreign workers, where there's kind of two avenues for coverage. And I think you make a good point there, Sabrina, that for one, and I do need to take a minute to clarify, for one to enroll in MSP, one must be physically present in BC. So once an essential worker arrives here, agricultural worker arrives here, then the application may be made. And for an individual who holds that permit of 6 months or more, um, coverage may be provided under as a deemed resident, and we're waiving the wait period. When I'm looking at those who may normally not be eligible, as their permits are shorter than the 6 months, say they're 3 months long, um, they can again complete the application for enrollment and include a copy of their permit, and temporary coverage will be provided. So it's until July 31st, 2020.
okay, thank you so
Does that
much.
answer the question okay? I know it's an odd way of looking at it, but for those with that permit of 6 months or longer, normally would be eligible for MSP enrollment. And to ensure that coverage is provided, we are waiving the wait period, so one may have day of arrival coverage. For those who 3 months or shorter, they will have access to the temporary coverage until July 31st, or the end of their permit, whichever is sooner.
Thank you. And is there a monthly premium fee for the temporary MSP coverage?
For the work permit, there is not. As of July 1st, 2020, MSP premiums have been eliminated, so there is no monthly premium associated with MSP coverage. There is.
Okay.
I'll just like to just clarify that a little bit more, is that we don't have the premiums, but international students who are coming to BC with a valid study permit will face the international or the health fee.
And so, is there a possibility for international students who to have that fee waived if they're not able to pay for it at the
Um, so it's a little bit harder because this is actually not our responsibility, but accounts with a balance will remain due. But Revenue Services of British Columbia, who is responsible for collection of the health fee, has suspended debt collection activities as they're focused on assisting citizens with account services. So payments will continue to be accepted for those who can pay during this period, which is encouraged. But if one needs help with their account, they would be encouraged to contact Revenue Services of BC, where a representative there is available to assist.
Perfect. Thank you so much for clarifying that. The other question is, does a person need to wait for MSP coverage to access COVID-19 testing? And if and will they be charged for a test and treatment for COVID-19 if they haven't been enrolled in MSP?
One thing is that I would never encourage anyone who has questions about COVID-19 to wait. As a first step, I would encourage any individual to contact 811 with their questions regarding um, treatment and diagnosis. I'm not a medical professional, so I wouldn't be able to give direction on that other than talk to 811 regarding any care you feel you may need. As of right now, I can tell you for sure that if an individual goes into a physician's office, that we have set it up and we are increasing communication to physicians regarding coverage for treatment within their offices. It was brought forward that we started communicating out to physicians and perhaps it wasn't reaching everyone. So we have been working within the ministry to increase communications regarding that coverage. So again, if you have any concerns or um, any questions regarding this, individuals are encouraged to email the generic email on the reference and contact um, page. However, I will always give the um, direction to call 811 if you have any questions regarding what you should do for treatment or diagnosis of COVID-19. If anyone has any questions where if they are in fact eligible for enrollment in MSP, to contact Health Insurance BC.
Perfect. Thank you so much. And so if an individual is applied for temporary MSP coverage, do they need to wait for the BC services or temporary coverage document to be issued to them to be able to access MSP? And if no, what type of proof would they need to take with them when seeing a physician or the hospital?
hmm Now, the first thing I would say is no, under our regulation, anyone who has completed enrollment and has MSP, effective MSP, can always take their PHN and another piece of photo ID to the physician's office, and they will receive insured service. If one is questioning if their application has been finalized and they're waiting for their PHN, I would suggest contacting Health Insurance BC directly or the branch to request the information. However, you do have to have the personal health number. And it would be on the non-photo card or the confirmation of coverage letter. So if one doesn't have that, I would suggest contacting Health Insurance BC.
Okay, thank you so much. Another question is regarding temporary foreign workers and the implied status. Temporary foreign workers can be on an implied status for up to 12 months while waiting for their new work permit to be issued. Could you please explain why the province has imposed the time limit of December 1st, 2019 for workers on implied status?
We did look up the IRCC processing timelines for creation of this policy, and we tried to respect what was on the website there. Um, I would suggest that if anybody is having concerns regarding coverage during this time and they are on implied status and they have been on implied status prior to December 1st, 2019, to contact the branch directly with their situation.
Another question is it possible to have retroactive fees covered for those who may have received emergency care after March 1st, but they weren't aware that they would have been eligible to apply for the temporary MSP?
Retroactive coverage. So if we're looking at temporary coverage, we would have to look at when the request was received for enrollment. So I think, like I said beforehand, where temporary coverage will be provided as of the first day of the month in which the request is received by HIBC. And given that we're not too far off of March, it would depend when the application for that temporary coverage was received. There is always the ability to appeal to the ministry for any retroactive bills, and we can look at the individual circumstances.
Another question that has come is in regard to people who are not currently eligible for MSP as they're here without documents.
Mhm.
Are you aware of any COVID-related services that they would be covered for under this new policy?
So right now, there is increased communications to physician offices regarding coverage for physician services for those who are ineligible for MSP enrollment. So we have been increasing our communications, knowing that at first our initial broadcast out of the coverage for ineligible individuals perhaps didn't reach everyone. So we have upped our communication to ensure that those who require services can go to the physician's office, and it would be up to the physician to diagnose and suggest treatment there. Under normal circumstances, those who would be ineligible wouldn't have it funded. However, my one step back would always be, if care is required, please contact please contact either Health Insurance BC if one thinks that they may be eligible, or contact 811 for direction on what to do, or to follow up questions specific to COVID-19.
Thank you, Kate. Another question has come. Individuals have noticed that their clients are having problems to find medical services once they receive their temporary MSP. And so, is there a specific process for them to find a doctor? Are they allowed to go to every single clinic or hospital, or is there limitations?
So with the temporary coverage, once it's provided, it's the same coverage as anyone who is enrolled would have for the duration of the coverage time period. So we haven't really put any parameters on what is covered or not. Everything should be covered. In terms of access to physicians, again, I would point to 811 for direction on that. It's kind of outside of my scope of knowledge, and perhaps they can direct where to seek care if it's required.
Okay, thank you, Kate. In the normal MSP application process, um, IRCC would submit and confirm as well that they've accepted and received their work permit. And so, how can a person renew their MSP coverage during this time if they don't have that confirmation yet from IRCC?
Okay, again, I think we're looking for those who um, are new to the province, or those who had previous coverage on a work or study permit and they've applied for a new permit. Again, for the new coverage, we would require that work permit to be eligible for enrollment. So you would have to have a copy of that permit. For those who are in the province and they were previously enrolled in MSP and their permit has expired and they've applied for a new permit, I would point back to the discussion on the expired permits for those who were on implied status. Again, if it had expired December 1st or later, they could apply, or they could be provided temporary coverage, provided that they give at the very least a receipt showing that they've applied for their new permit prior to the expiration of their old permit. I don't know if that answers the individual's questions, but I hope that it does. If it has any questions regarding, you've applied for a new permit and it's very specific to when you've applied for it and when your old coverage expired, I would suggest contacting Health Insurance BC by phone or by email, or my office at the email provided. We could look into the specifics for the individual.
Okay, yeah, thank you, Kate. I think that there's quite a few questions that are really specific and really related to individuals. But you
Mm,
mentioned that the temporary MSP coverage will be available until July 31st.
mm-hmm.
And so, will more information be made known or shared closer to this date? People are just concerned and worried about what will happen after this expiry date if an individual still requires healthcare coverage due to COVID-19 or due to a treatment that they were in the process of receiving. Have any thoughts been given to that?
Yes, a lot of thought has been given to that. So we are in the process even now of monitoring the requirements for both the waivers and the temporary coverage to see exactly what has been required and what continues to be required. And we're also taking note of the general direction from government in terms of the state of emergency. So we are continually monitoring and looking forward. We know that when a temporary coverage document has been provided, it has been provided to July 31st, and in the coming months, we will have to review what we are going to have do August 1st onwards, and that will be communicated to online and as best as we can out to the public to ensure that everybody knows what's going on prior to August 1st.
Okay, thank you, Kate. I think, yeah, many are worried and wondering about what's going to be happening. And so we also have individuals who are asking, who are serving and supporting clients who have an MSP balance owing from their previous account, probably under the time when MSP fees were still being charged, but now they've lost their job and aren't able to provide pay. Do you
Mm-hmm.
have any who should they be contacting to discuss
Mm-hmm.
either waiving or creating a more lenient payment plan?
Mm-hmm. So I would again look back to Revenue Services of BC, who I explained beforehand in terms of the health fee. Um, uh, Revenue Services of BC has suspended debt collection activities, and they are looking to um, help citizens and those in the province with their premiums as well. Again, payments will be accepted. However, if anyone is having some concerns about ability to pay or required or want to talk about options for a payment plan, I would suggest contacting Revenue Services of BC directly. And you know what? I realize that it's not a number that I did include in the slide, and it's something, Sabrina, I could send to you after for perhaps distribution as part of this uh, slide or to the group members. But if anyone does have questions, they can always email the branch directly, and I can provide them with the contact information.
One other question that came up is, does 811, and that's you mentioned calling this number a few times, do they know about the temporary billing code PHN for non-status people without MSP coverage?
I believe that they know that coverage is available. Information has been shared with them. However, I can ensure that it is well known by 811 call takers.
Okay.
Yes, they should. The general answer is yes. However, we will confirm that it's well known.
Okay, thank you. I have it's a comment and a question at the same time, and this is from somebody who's joined who themselves is a healthcare provider, and so they're concerned, but also seeking clarification that medical doctor services will be covered for individuals who are ineligible for MSP, but hospital fees aren't. And so they're a little bit, so they're wondering and concerned what that would mean if they would need to refer an individual to a hospital.
Mm-hmm. Two sides to that. Work is ongoing in the ministry regarding this. Um, so it is continually, like everything in this kind of current climate, it's ongoing. So work is happening there. And if you had, again, like I would say, any specifics, I would say contact me. Please contact me directly at the branch, and I can forward it to the appropriate area.
Perfect. Thank you so much. And we'll definitely be following up. So if your question wasn't asked or you didn't receive the clarification that you were looking for, please send your questions to us at AMS and we'll compile them and share them with Kate as well to seek further clarification. And so I have a question for about an individual who's supporting a permanent resident family, and they're now having one of the children is turning 19 and becoming an adult, and so they're wondering how they should be looking to get their own medical services card and their own account as an adult, and how they would go about doing that, as they're understanding that the offices are currently closed.
hmm Um, so two things in specific to this individual, as I can't really provide any specific information to um, them, I would suggest if there's any issues with that individual enrolling to contact the branch directly, and we can discuss individual eligibility for MSP enrollment. However, in general, we have looked at our two-step enrollment process, and this is not applicable to those with temporary permits where a non-photo card is issued. However, for those who are Canadian citizens or permanent residents, um, the first step in applying for MSP is completing the application for enrollment. The second step is one would normally be required to attend an ICBC agent with primary and secondary ID. They'll get their picture taken and a photo BC Services card would be issued. Knowing that some may be unwilling or unable to attend a BC, or an ICBC office to complete that second step of enrollment, we have created policies. Again, I'd like to say that this is not specific to those in the province with temporary work or study permits, but in this case, if one needed to complete the initial step of enrollment, once the application for enrollment form is completed, I would direct an individual to contact Health Insurance BC, where temporary coverage may be provided and a confirmation of coverage letter would be issued. For those who are already enrolled in MSP and their BC Services card is or will be expiring shortly, and again, they are not able to, for whatever reason, or perhaps not comfortable to attend an ICBC office to complete that second step for renewal of enrollment, again, one can contact HIBC and a confirmation of continued coverage letter would be issued. So this again would state the individual's name, PHN, and coverage time period. So one isn't required to go to HR or to ICBC in order to complete enrollment in the current climate. There are temporary measures in place. To discuss eligibility, I would direct this individual to contact either Health Insurance BC or the branch directly. And in terms of completing enrollment, contact HIBC directly.
Yes, thank you, Kate.
Mm-hmm.
And if you can, I think that this is this topic is quite complex, as we're hearing a lot of different types of immigration visas and different immigration situations when it comes to MSP. So if you could maybe, and there's I think confusion as well between MSP and temporary MSP. And so could you please clarify which services are covered and available under temporary MSP?
hmm So, again, I would be careful with the language because it is temporary MSP coverage. However, it is still full MSP coverage. So, the services that would be available to one, the insured benefits that would be available to anyone who is enrolled would be available to those who enrolled temporarily as well.
Okay, thank you, Kate. So just to clarify, so if an individual has temporary MSP, there's no need for their need to go to the physician or to the hospital to be related to COVID-19. Is that correct?
Correct. If they're enrolled for temporary coverage, then um, any insured benefit would be provided, would be covered. It would have to be an insured benefit, but anyone who has temporary coverage um, to the physician it would, or to the service provider, other than the actual document that may be provided to confirm enrollment, um, it should look exactly the same as one who would be enrolled for a longer period of time.
Okay, thank you. I think that's where the confusion was, that individuals thought it had to, the temporary MSP was only eligible for services that were related to COVID and not for other eligible services.
Mm-mm, mm-mm. No, no. The temporary coverage is MSP coverage.
Okay, thank you. And you mentioned a few different languages at the start where it's possible to apply for MSP. Was Spanish one of those languages?
It was not. Are you talking about the languages that Health Insurance BC provides on behalf of? I think that's what you're referring to. I know
Yes.
that our call center currently provides services in English, French, Punjabi, Cantonese, and Mandarin.
Okay,
Spanish is
thank you.
not one of them. However, if there is a demonstrated need, I would suggest forwarding that suggestion to the ministry to review.
Okay, thank you so much. Yes, many individuals
Mhm.
who are part of the temporary foreign worker program, for them, Spanish is their first language. So that's why the question kept coming up if
Mhm.
Spanish was one of the languages as well. And
Mhm.
I'm just aware of the time, and so we do have many, many, many more questions. And so
Mhm.
I think that these are questions that we'll take back, we'll collate, and we'll share with you, Kate, and just look to see if we can maybe um, create some kind of an FAQ response as or look to provide a response to individuals here
Mhm.
who are asking all
Again,
these
I would
questions.
say, our FAQs again would be general, which doesn't really help if you're answering to a specific question. So again, I would encourage anyone with the specific questions, looking at a specific instance, to please email that to the one of the two email addresses that are contained in that reference slide, and then we can do a review and make sure that you have the correct information.
Okay, thank you so much, Kate. So as you can right now see that reference and contact slide and the different emails and websites to connect with in regards to all of your questions. And so I just wanted to say thank you, Kate. Thank you so much for taking the time to answer all of the questions. And I do know that they are quite complex. And I think there was a lot of confusion and about temporary MSP. And so I hope that this webinar looked to assist and provide some answers. I know it didn't provide all the answers that individuals were looking for, but I hope that you have the resources and the references of who to connect with to get that further information. And so if we could just go to our closing slides, Con, I just wanted to um, thank the AMSA team and thank everyone for joining us today and thank Kate for your presentation. And so we will be sending an email to all participants online for, as part of our webinar evaluation. And so we do request that you take the time to fill it out, as we do rely heavily on all the information from the evaluations. And please also respond to that email with your specific questions, and we'll look to also send them on. And I just want to say a special thank you to Kate, for sharing your time and your knowledge with us, looking to support temporary residents here in BC with MSP. And I wanted just to say a quick thank you to the AMSA team, Con, Sarah, Melissa, and Alejandra, for all of your support in the background. And on the next slide, I'd just like to once again thank our funder, the Government of Canada's Migrant Worker Support Network program, for funding today's event. So thank you, everyone. Have a great day. And on the last slide, you can see the Migrant Worker Hub and the website of the Migrant Worker Hub, where we will be posting the recording of this video for 2 months. So thank you so much, everyone. Hope you have a great day. Bye-bye.